In some instances, surgeries can be a better choice for fracture management. For example, in a patient who requires to be back to work quickly, surgery will allow you early ambulation. That means you can walk or you can use your limb as quickly as possible. Even sometimes in some fractures, for example, if you break your shin bone or your femur, which is your thigh bone, patients can walk almost immediately with some assistive devices. So in patients who are interested in quicker return to activity, in sports people who get fractures and who get injuries, surgeries allow you quicker rehabilitation. In some fractures, they cannot be managed with plaster without adverse outcomes. For example, if you choose to manage a femur fracture, that is your thigh bone, if you choose to manage femur fracture with plaster, you will tend to have longer stay in bed to allow the fracture to heal correctly. But if you do surgery, this allows you to have quicker healing and quicker return to activity. Other fractures that cannot be managed with a plaster also include intra-articular fractures. So fractures that are around the joint and involve and break through into the joint. So those fractures require to be put back exactly as it was. So anything more than 2 millimeters in terms of a step off, like if this is your reduction, so if you have 2 millimeters of step off, then that tends to increase your likelihood of getting arthritis in future. So surgery can be a useful tool in the management of a lot of fractures. After a cast has been put, we usually give patients danger signs. So if you have pain when you're in the cast, and that pain is not being reduced, that is not being corrected with analgesics, that is pain medication, this is something that needs you to come to hospital as quickly as possible, and even sometimes we advise patients on how to take off casts. In some instances, we also advise the patient on how to take care of the cast, whether to put it around water, how do they manage, can they walk on this cast? So these are just some of the things that we advise patients. So follow-up is important because it allows your surgeon to be able to assess how your fracture is healing, especially in a minimally displaced fracture. Usually you want to do an X-ray as maybe in 1 week intervals until maybe 3 to 4 weeks to see if you have displacement of the fracture. Because if you have displacement on the fracture and that is missed because you have not been following up with your surgeon, then your fracture will tend to heal in a mal-aligned manner. So it is very important to have the fracture heal correctly within the cast. And it is very important, even after the cast has been put in, if any issues arise from the cast, you need to reach out to your surgeon to be able to give you solutions as to what are the possible reasons as to why you're feeling as you are. Let's discuss your options. Book a consult today.